Hi, my name is JP Eichmiller. I'm the Director of Strategic Communications at Central Health. We know that where you live and who you live with can be a better predictor of your health than your genetic code. We produced the 2017 Central Health Demographic Report to help us better understand where the low-income and uninsured residents were residing and where they were concentrated throughout Travis County. Over the next few minutes, we're going to provide detailed analysis of how social determinants of health, such as transportation, affordable housing, and race, ethnicity, and demographics, can affect the low-income and uninsured residents of our county. The 2017 Central Health Demographic Report was designed to serve as a tool for the Central Health enterprise and its partners in determining strategies to provide healthcare services for the low-income and uninsured residents of Travis County over the next 5 years. The focus of the demographic report was understanding where and how we needed to provide access to health care for our patient population. In order to do this, we wanted to focus on three main points. First, our service locations, including urgent convenient care clinics, primary care locations, as well as our hospital system. Second, we wanted to know where there were high concentrations of poverty throughout Travis County, both today and 5 years from now. And finally, we wanted to examine our patient utilization data. We wanted to understand where our patients were living, as well as what locations they were accessing services the most. The map on this page shows where our clinics and hospital locations are throughout the county in relation to where our patients live by zip code. Once we understood where our patient population resided, we wanted to cross-reference that with the overall population, particularly families as well as families in poverty. This map, taken at the census tract level, shows that the greatest concentrations of families in 2017 are now residing largely outside of central Austin, to the northwest in Valente, Anderson Mill, and to the northeast in the Pflugerville area. When we looked at the greatest concentrations of families in poverty, however, we saw great concentrations to the north in the Runberg area, to the east in Colony Park, and to the south in the Dove Springs and Mentopolis neighborhoods. Knowing where high concentrations of poverty are today is important, but equally important for Central Health and its mission is understanding where new pockets of poverty and where residents with high levels of need will be residing tomorrow and in 5 years. So the next step of this report was really looking at where we're projecting high increases of families as well as families in poverty. Once we understood where the highest concentrations of poverty are today and what we're projecting to change over the next 5 years, we were able to draw a picture of what we were projecting Travis County to look like 5 years from now in 2022. On this map you can see 40 census tracts are highlighted, and within these 40 census tracts we're projecting to have 1/2 of all Travis County's families in poverty, over 18,220 families. We divided these 40 census tracts where we're projecting to have the highest concentrations of poverty into 9 focus areas so that we could do further data analysis and really dig into the demographic trends that might be going on in these areas. These areas included Pflugerville in unincorporated Travis County to the northeast, Northeast Austin, which includes the St. John's and Heritage Hills neighborhoods, MANOR to the far east of Travis County, North Central Austin, which would include the Runberg area, East Central Austin, Colony Park and Hornsby Bend, Southeast Austin, including the Mentopolis neighborhoods, South Austin, which includes Dove Springs, and the Del Valley areas to the southeast of Travis County. Within each focus area, we focused on the total population, the access to healthcare services from our network of urgent care, primary care, and hospital clinics, which school districts serve that area, public transportation, as well as access to cars, and subsidized public housing. We also examined the demographics of each focus area, including the race ethnicity of the population, the age, and the gender breakdown. By combining this demographic analysis with social determinants of health, such as access to public transportation and the availability of subsidized public housing, we're able to develop a more complete and robust picture of the needs for our patient population. Once we had done an analysis of where the low-income families are residing today is where we're projecting they will live 5 years from now, we wanted to go back and really cross-compare that information with where we were treating and seeing our patients. To do this, we focused in on chronic conditions. Patients experiencing chronic conditions often require additional resources to manage their healthcare needs. Inadequate care for these patients often leads to overutilization of emergency departments, which creates operational and financial strains on our safety net healthcare system. There are currently more than 32,000 patients served by Central Health who have received a diagnosis of one or more chronic conditions in the past 2 years. These include behavioral health, chronic lung disease, diabetes, heart failure, hypertension, cancer, or kidney failure. For each of these chronic conditions, we did an analysis of our clinical and hospital data to look at how many patients have been diagnosed with each chronic condition, what were the patient demographics, such as gender and age, what were the top 10 zip codes that these patients resided in, and what were the top 10 locations that those patients were receiving services. Once again, this analysis of chronic conditions allowed us to really understand whether we were serving our patients close to where they live and in the correct settings. Now that we've done this analysis, Central Health is working closely with its partners to determine how we can utilize this information for new strategies going forward. Because of the analysis we did in this report, we're now better able to project what Travis County is going to look like in 5 years and how Central Health and its partners should respond. For example, we know the highest concentrations of families are projected to be outside the center of Austin, in northwest Travis County, and in Pflugerville to the northeast. We're also seeing the continued development of the Eastern Crescent, with the areas extending from the north in Pflugerville, going farther south through Colony Park, Hornsby Bend, and Del Valley. And we also know there will be a continued need along the I-35 corridor, particularly in areas of historical need, such as Runberg to the north, and Dove Springs and Montopolis to the south. Over the next few months, we'll be taking this report out into the community to gather feedback and share this information. We will also be working with partners in the low-income housing, transportation, and social service areas to figure out how we can work together, share data, and plan better to better serve our patient population.